How does the MoCA cognitive assessment work? Imagine a quick checkup that can give doctors a snapshot of how well your brain is functioning. That's what the Montreal Cognitive Assessment, or MoCA, does. It's a short screening tool designed to spot early signs of cognitive problems, especially those linked to dementia and memory loss. The test looks at many different parts of thinking, like paying attention, solving problems, remembering things, understanding language, and even spatial skills like drawing or copying objects. The MoCA usually takes about 10 minutes to complete. During this time, a healthcare professional will ask you to do a series of simple tasks. The total score is out of 30 points. If you score 26 or higher, it generally means your cognitive abilities are within the normal range. Scores below 26 might suggest some mild cognitive impairment or early signs of dementia, but only a trained healthcare provider can interpret these results properly. The test includes several key parts. One involves drawing a line that alternates between numbers and letters in order, like 1, A, 2, B, and so on. This task checks your ability to switch between different types of thinking, which is called executive function and attention. Another part asks you to copy a three-dimensional cube or draw a clock face showing a specific time. These tasks evaluate visuoconstructional skills, which are your spatial and visual abilities. You might be asked to name animals or objects to test your language skills. There's also a memory section where you listen to a list of words and then try to recall them immediately and after a short delay. Attention is tested through tasks like repeating numbers forward and backward or tapping when you hear a certain letter. Language skills are checked with sentence repetition and quick word fluency tasks. To assess your ability to think conceptually, the test asks you to find similarities between pairs of items, like comparing an orange and a banana. Finally, questions about the current date, your location, and the city you are in help evaluate your awareness of time and environment. Each correct answer earns points, and the total score reflects your overall cognitive health. If someone has less formal education, an extra point is added to their score to account for that. It's important to remember that many factors can influence how well someone does on the MoCA. Fatigue, stress, emotional state, hearing or vision problems, medications, and other health conditions can all affect the results. That's why healthcare providers interpret the scores in the context of the person's overall health and history. The MoCA is a screening tool, not a full diagnosis. If the results suggest possible cognitive issues, further testing and evaluation are needed. In the realm of dementia and memory loss, the MoCA is especially helpful because it can detect subtle changes in thinking that might not be obvious during regular checkups. Early detection can lead to earlier interventions, which may help manage symptoms better. Overall, it works by carefully and systematically testing different brain functions through simple, structured tasks, giving a quick but meaningful picture of cognitive health. Always remember to consult a healthcare professional for a comprehensive assessment and personalized advice.